Focal therapy involves using a robotic arm to deliver ultrasound waves to the prostate to treat prostate cancer. In this case, while I was at the bedside with the patient in Abu Dhabi, I was able to transfer controls of the robotic arm to my colleague in Cleveland, Ohio.
With an MRI that demonstrates a very clear target. So we were able to successfully complete the ablation, that is the fancy medical word for destruction of that small area of the prostate. After a while, I forgot that I was doing a remote surgery.
He was able to seamlessly perform the procedure from beginning to end without my intervention. It was as if he was in the room sitting next to me.
This milestone reinforces Cleveland Clinic Abu Dhabi's dedication to providing world-class expertise to those who need it the most. It set the stage for a future where geographical boundaries no longer limit access to excellence in healthcare.
High five.
Good job, guys.
Fantastic. Dr. Waleed, please come to the stage. And I'm going to begin. You ended with a high five. I'm going to give you a high five for that.
Sure, thanks.
Remarkable. World first, here in Abu Dhabi, with your colleagues, transcontinental. Let's go into that. What do we mean by that? And did you think you'd ever see this experience coming here and you'd be part of it?
Sure. Well, certainly, the concept of being, or the dream of being able to take care of people from far away has been the stuff of science fiction for many, many years. And if you can think about us as individuals, when we take care of patients, we can only take care of a certain amount of patients. There's a limit to what an individual person can do. But the hypothetical concept of being able to deliver care from afar opens up doors for millions of people to be able to potentially have access to care that may not be immediately available. And so that was, this is the premise of something like this. And traditionally, the idea of being able to remotely connect and operate has been limited by the speed of how information travels and how fast and how safe you can get information back and forth. With new technology, with 5G technology, the ability to transfer information has advanced so rapidly that the potential, as you can see now, is we can connect and communicate very, very complex machinery at speeds that become imperceptible to allow us to manipulate machines, to visualize things so that it can be done from afar. So this really was a proof of principle to show that something like this is possible. There are a lot of groups around the world looking at different ways to connect remotely with various forms of technology and deliver care. But this is really an example of what can happen when very, very smart engineers, very, very smart software people, industry, regulators, scientists, clinicians get together and try to deliver something.
And very, very smart surgeons as well. As you say, this is possible because of the technology when it comes to remote connection. And it's more than simply a case of a virtual chat. You're actually sharing like high-res information across the waves as well, so that's important. But the other piece of technology is the robotic surgery. Let's talk about that.
Sure. So, the robotic surgery is a broad term, and it really just means the ability to control some piece of equipment at in a very precise manner to reach things or to reach parts of the body or to manipulate things in a very fine way that the human hand may not be able to do, and that's really the principle behind it. And so there are many, many different applications of robotic surgery, whether it's delivering something within the brain or robotic abdominal surgery or thoracic surgery and so forth. And so this example was delivering high-frequency ultrasound into the prostate where the machine can calculate where the mass is and then develop a treatment plan so we can accurately treat one area of the cancer without affecting the rest of the body.
Now, of course, your excitement was palpable in the video when it all happened, and it still is there now. Did you foresee this coming to the UAE, being part of this experience?
Well, I think it goes to what we were talking about earlier, the passion for innovation here and the way that regulators can open up doors for you and cut red tape that really is difficult in many other countries. So we were able to get the trust of the regulators to trust us to be able to trial something like this. Certainly there was a lot of work in the background, testing and retesting and troubleshooting before we delivered this to a patient. But it just shows the level of forward thinking that this country's leadership is all about.
And speaking of forward thinking, what are yourself and your teams, your very talented teams at Cleveland Clinic, thinking about in terms of the future? Where does the vision lie?
Well, I mean, you know, the future is wide open, but our goals really are, like I said, you know, the prior session was about international care and patients coming here. The future will be able to allow us to go to other people's homes without leaving, right? So the idea is, imagine us here operating on someone in a remote village in a small country that may not have the resources, for example. That's the future. That's the dream, really, is to be able to deliver this kind of care everywhere.
So, for example, surgeons based here in Abu Dhabi connecting with a rural area and bringing that type of level of service.
Exactly.
And for that recipe to work, you would need the surgeons on the other side, you would just need the facilities.
We would need education, we would need connectivity, we would need training.
So a fair few factors, a fair few hurdles, but certainly this gives us hope and it gives us possibilities.
Exactly.
And as we have an esteemed audience gathered here and they come from various levels of expertise, what would you say, Dr. Waleed, would be your call to action when we try to inspire greater collaboration and where we want greater funding, research?
Well, I think it's just a great note to close on because this whole week has been about bringing people together from all over the world, from various industries, from various specialties, because healthcare advances with the collaboration of everything. And it requires countries, it requires industry, it requires healthcare providers, it requires the community, all to work together in order for us to advance medicine and science, which is what this whole week has really been all about. So I think this is just a small example of what is possible when we're all thinking the same way with the same goal, which in the end really is to make human lives better.
Absolutely.
That's really all it is about.
And you're right to say this is a really powerful note to end of the week on. I see that we have members of your talented Cleveland Clinic Abu Dhabi team here with us, and it's always a team effort, isn't it? What would you say is your experience and your main takeaway from Abu Dhabi Global Health Week?
Well, I think, once again, I think if you think about what 10 years ago in Abu Dhabi was, or 15 years ago in Abu Dhabi was, no one would have thought that companies, influencers, the world leaders in healthcare would be amassed in one place, and that just shows the testament of, I think, what's to come. I think this is just the beginning of what we're going to be able to accomplish here.
And we really appreciate frontline surgeons like yourself, pioneers in the work that you're doing, taking the time out of your busy schedules and coming to speak to us, share with us the innovations that are happening right now, and also share the success story of the international collaboration behind this. And on that note, I'm going to ask my audience to collaborate with me in giving a big round of applause to Dr. Waleed for ending the grand finale with the announcement of this pioneering surgery. And I want to say thank you, Dr. Waleed, to you and your team, and thank you to our audience for joining us. And we hope to see you at the next event and follow our work on M42's main sites. Thank you so much. Thank you.